Good morning, everyone. Welcome back to Work and Walk, day 3, last day. We're glad you're here, glad you've been with us, appreciate it. A few things before I talk about the session. As per usual, remember the time zone. If you're here, you have remembered it. If you're not, maybe you haven't. We've certainly had a few people that got mixed up on the time zone based out of Central Standard Time, where we are, me, us. Secondly, again, we want to thank our sponsors for their generous support to make this conference happen. We're very appreciative, and we'd like you to go visit them in the exhibit hall, in their sponsor rooms. Check them out, check out the resources, send them a message. Thank them as well. We appreciate that. Next, I mentioned this yesterday. Today, it's even more important. In our booth, our exhibit sponsor booth room, Star Trek room, that's the way I think of it. In addition to some of the resources there is an event survey. Please complete that survey for us. We really, really want to hear from you. What you thought, what you felt, what you didn't like, what you loved, all that stuff. Also, we will, if you're still unsure, we will be providing an on-demand version of the conference in about a week or so. We'll send it out via our newsletter to announce when it's available for you to watch. So you can watch all of it. You can watch the parts you missed. It will all be available to you. Next, remember, at the end of the conference today, there will be 3 breakout sessions, Zoom rooms. You'll find the tabs in the virtual lobby with the date and time for each of the room and the topic, so you can get there. They are Zoom rooms. They're off this platform. Also, you will need to exit session 5 today at its conclusion after the interview with Jesse Sinz and Kelsey in order to start, session 1 to 5, otherwise known as session 6. Because it will not start automatically, just a little reminder. Also, I know the list is long, we want to give a special thanks to our technology folks, Event Technology Services, who have created this lovely platform and made for this seamless experience. We're very grateful for their work. If there's anybody out there that's looking for someone to host a meeting like this, you might want to reach out to them or reach out to us and we will connect you. Let's see, today's sessions. So today, the first session that we'll hear is from the spinal cord injury community. So this is the last of the stakeholders in our version of the 5 major key stakeholders in this work. So you'll hear from Perry Cross from Australia, you'll hear from Corinne Jeanmaire from the Netherlands, and you'll hear from Kim Anderson here in the United States. And then after that session, will be, or actually those presentations, there will be another panel discussion so we can continue the conversation. And then following that, as I mentioned earlier, Kelsey will be interviewing graffiti artist Jesse Sinz. Now, the last thing, I just want to thank all of you for making this conference work. Just a really quick story. Many years ago, I wrote about this in a blog post some time ago. I worked as a bartender in Philadelphia, and I had a regular monthly gig every 3rd Thursday or something that I really did not like, but it taught me a lot. It was called Parents Without Partners, and it was kind of a depressing gig. You could probably imagine. It was in an older restaurant, bar, club. Actually, it was kind of famous on the main line of Philadelphia, which is where I grew up. Count Basie had played there, Duke Ellington way back in the day. It was kind of a big band heyday. But anyway, this Thursday night, it was a group of folks that came out of broken relationships looking to make a love connection. It was a rough night, I think, for everybody all around, but it taught me something over the years. And I think back on it quite a bit. And it really essentially is that you just can't put people in a room together and expect they're going to connect or that they know how to connect. Because you need to have some people in the room who know how to connect and how to connect others. And I just want to thank so many of you who have been in the room over the last couple of days and have made this event work, because you have done that work, that connecting work. Sometimes I think we forget how important that element is to this work that we have to do. Because it really, at the end of the day, it's not about limiting our view of the problem or limiting our view of the solution. It's actually about expanding our view of the problem, expanding our view of the solution. And we need folks to connect us so that we can see from one another's perspective and point of view. So many of you have done that, and I think many of you have helped to create and foster that over these last couple of days, and I'm hoping that we will continue with that trend. And thank you for making that space where we can connect with one another. Please keep it up, even past, obviously, but remember that key element. It's always sort of necessary and something I think it's easy for us to forget. Lastly, I just want to say, don't hesitate to reach out to us at U2FP. If anything has spurred on questions or a desire to become more engaged, or some direction or some connection to anything you've heard or any people that you've heard talk, that's another part of what we do. I mean, it's in our name. So we do try to connect you to this work, connect you to other people, connect you in a whole number of ways. So do not hesitate to reach out to us. So with that, I'll be quiet. Let's get on with session 5, spinal cord injury, community and advocacy.
Now you're going to hear a few presentations from folks from the spinal cord injury community specifically, and the advocacy, both for the community and for specifically curative research. Now first you're going to hear from Perry Cross. He's the executive president and founder of the Perry Cross Spinal Research Foundation in Australia. Perry is going to talk to you about his work in collaborating with academic institutions and his strategy towards moving discoveries along the pipeline of translation to clinical relevance. Please welcome Perry Cross from Down Under.
Hi there, folks. My name is Perry Cross. I'm the founder and executive president of the Perry Cross Spinal Research Foundation, based on the Gold Coast in Queensland, Australia. So g'day from Down Under, and thank you very much for the invitation to speak at this year's Working to Walk Symposium. It's always a pleasure. So let me kick off by, firstly, a bit of background about who we are. So our organisation was formed a little bit over 10 years ago, and we aim to facilitate and collaborate and initiate the connections and the research required to find a cure for paralysis. And I guess just to add a bit of context to that, I was injured playing rugby union over 25 years ago, and then had a keen interest in medical research. Not long after my accident, a gentleman by the name of Christopher Reeve was injured, and he was obviously the Superman actor when I was a kid in all these movies, and was also a great advocate and a great fundraiser for medical research through his own foundation. And that was part of my motivation to get involved in medical research. And then when he passed away, I decided to become part of the voice and part of that advocacy and part of the fundraising to help find a cure. So that was part of my motivation. This is a picture, just a few of our members of the team. There's a much bigger group, but that's a few of our main researchers. So what are we funding and why? Let me start by saying the foundation supports the Spinal Injury Project, abbreviated to SIP, which is based at the Menzies Health Institute in Queensland, and the Griffith Institute for Drug Discovery at Griffith University, and we're working towards human clinical trials. So this is a snapshot of our research. The first part of our research, and we're focused on working on chronic injuries, which is important to say. So we would put potential people in our trial through a prehab phase, which is important for reasons which I'll cover in a minute. Those people would then go in and have a cell biopsy taken from the olfactory and sheathing cells in the nasal cavity. That biopsy would then be purified in the lab. Those cells, after being purified, would then be made into a nerve bridge, and then that nerve bridge is then transplanted into the patient. After that process has happened, then our patients would go through a rehab period, and that rehab period would be for a sustained period of time, and obviously complemented by other technologies. So the first phase, our prehab, is what we refer to as a sustained functional therapy. And this is key to help making the spinal nerve reconnect, and involves activity-based rehabilitation combined with a range of physical, motor, and sensory gym-based activities. This is a critical component which will allow the nervous system to make new connections and relearn the necessary fine control and proper motor and sensory function. We believe that without long-term based rehabilitation, cell transplantation alone probably won't be successful, or very effective at least. This approach has recently been tested on mice in our labs, and as I said, we're working on cell therapies that can be complemented by other technologies such as electrical stimulation, bionics, and rehab. There's many research projects around the world, as we'll see as part of working towards, that can be complementary to our cell technology. So who are we collaborating with, and why? Collaboration is core value to the foundation. Some of our partners are Griffith University, who are our research partner, Making Stride Rehabilitation Centre, and they're a community organisation, community rehabilitation centre that are visited by many people from all over the country on the Gold Coast. And more broadly and nationally, we're part of the Australian Spinal Cord Injury Research Collaboration, which I'll talk about more as well. So what are the obstacles? So finding adequate funding for medical research has always been difficult, and this continues to be the case. And it's also very competitive, so it's not news to anyone. Governments, nationally and jurisdictionally, have no dedicated funding programs for supporting spinal cord injury research in Australia. It's very ad hoc. Despite the high costs and the devastating impacts of spinal cord injury, it's never been identified as a priority investment for research. So I'm sure most people understand that there is a high cost associated with long-term care of people in the community, and that's where we see there is obviously great need for that care in the community, but that cost is also something that government should recognise and weigh up with investment in medical research. And there's also many great causes in the community, and we're all competing for that same funding. A small percentage of the population is affected by spinal cord injury, so that obviously makes it more challenging. And obviously causes like cancer, where there's a more broad impact across the community, are very well funded. The world has changed as a result of COVID-19 and the coronavirus, and it comes with its own challenges to find funding to support research. And organisations like ours are now concentrating our efforts on finding new fundraising methods, which is, comes with its own challenges. So what does success look like for us? Obviously our mission, we're very focused on a cure for paralysis for all. And that's an important thing to add. We don't want just the chronic injury recovery or acute. We want recovery for everyone. So some of those steps include empowering the spinal cord injury community to fundraise and contribute to the research and have their voices heard. So we feel it's vitally important that the people scattered across the country have the tools and the voice to be able to go out into their communities and fundraise for research, but also be able to understand research and be able to relay the messages to their communities. So having understandable technology is important because often it can be very science heavy and hard to relay. And then having their voices heard, which we have a small team of people with injuries helping to advise our research team. And I think that's important as well. Obviously, creating awareness of spinal cord injury in the community. Often spinal cord injury goes unnoticed and unrecognised. So people see people in wheelchairs but don't understand why. So we need more awareness around this to help generate further funding. And then producing a roadmap for spinal cord injury research. And this is what I touched on earlier, as we are part of the Australian Spinal Cord Injury Research Collaboration. And our objective is to create a roadmap for the research in Australia nationally, because there are a few national state-based groups like ours in other states. And we're teaming up to approach our federal governments and our state governments for collaborative funding. And then one of those aims for our foundation is to change the rehabilitation protocols in Australia. When people suffer a spinal cord injury in Australia, they go into the spinal injury wards in the various states for periods of time as they sort of go through their recovery process. But rehabilitation as such is not a major focus, and it's particularly upon discharge. People aren't funded for ongoing rehabilitation. We believe strongly that if people are to ever recover from spinal cord injury, that they should have rehabilitation funding through the National Disability Insurance Scheme. But also ongoing rehabilitation helps people just with their day-to-day health. And then the ultimate thing for us is to launch a human clinical trial, which we're hoping to do soon. So what does it look like for us? Stage one, we've just completed stage one of our work, preclinical research. We've lobbied for about $10 million in funding through various state government organisations. And now we're focusing on stage two, which is the sustained functional therapy trial. We require about $1.6 million in funding to make that stage happen, which would put people through our rehabilitation program for a period of time. And at the end of that sustained functional therapy program, we hope to see people go into a human trial where the olfactory sheath nerve bridge is transplanted in their patients. And that we envisage would probably cost anywhere up to $30 million. So that's a snapshot of our work today and where we're at, and some of the challenges we face and some of the obstacles we face. So thanks very much again for allowing us to be part of this great symposium. And remember, everything is possible. Cheers.
Corinne Jeanmaire is the founder of the endParalysis Foundation in the Netherlands, a targeted funder of spinal cord injury research. And Corinne is going to provide us with a provocative challenge to all of us, but also specifically those in the SCI community. a challenge that suggests that we can do things differently. Dare I say, even need to do things differently in order to accelerate novel therapeutics for spinal cord injury. Please welcome Corinne Jeanmaire.
Hello, good morning, good afternoon, good evening. Welcome to my apartment. This is Corinne from the endParalysis Foundation. Today, my presentation is going to be about embracing modernity. What can we do to accelerate spinal cord injury research? That's ambitious, right? If I look at the picture of this very young and very cute girl, her name is Lou. She's paralyzed from the neck down. And if I think of the fact that we cannot in any way ensure her a life even close to normal, I cannot help but wonder, what can we do? What can we do more? What can we do better? We have to do better. We need groundbreaking progress. So in this presentation, we are going to have a look at the various levels of actions. In the first part, we are going to talk about approaches, because what's important is therapies, of course, it's research, but maybe that the level at which we approach things is important as well. Should we go for a micro approach, so focusing on one or a few therapies, focusing on one lab, or should we tackle the big picture and establish bridges between the labs and between therapies? Secondly, I'm going to say a few words about the endParalysis Foundation that will come as an illustration for a goal-driven approach, so which is more a vertical micro approach, because we have to be focused there. And as a third and last part, I will come back to what I would call a macro or a horizontal approach, which is going to be much more integrative and disruptive. And so we will end up with that, looking at what we can do each at our own level. So first, in terms of approach, where to place the cursor? On the left side, what you have here is a micro level approach where you can be very much focused on one discovery. You work as an individual foundation, individual lab. What you do is to push available knowledge towards the clinics. You try and translate this discovery. So there is a lot of personal motivation there. You can hope to get partial recovery out of that. We do have a few promising therapies here and there in the labs. And obviously, we need to do everything we can to actually prove that they work or that they don't work. So we need to replicate them. We need to try them on bigger animals, probably. And we need to get them to humans. On the other end of the spectrum, we have what I call the macro level. So that's more the big picture, where you are going to look at things considering cooperation between the labs, between the various organizations, institutions. There you very much start from a target. That's the way you are going to reach some disruption. So you are going to pull rather than push. And this is a much more collective approach based on a pre-agreed target. The advantage is that you are much more likely in that way to get a higher level of recovery, if not a cure. As an illustration for a focused and a goal-driven approach, I'm going to speak about the endParalysis Foundation. So we are a small foundation located in the Netherlands. We are very focused and goal-driven indeed. 100% of your gift goes to research. As a matter of fact, members of the board of the foundation are actually paying for the operating cost of the foundation. So it's the way that 100% of what you give goes fully to research. But not just any research. 100% goes to projects that are applicable to chronic research. Why? Because we consider that chronic is the biggest market. Everybody looking at this presentation is chronic or is going to become chronic in a few days or weeks. That's where the need is. That's where you have stability, and that's where you can more easily get reliable results from your clinical trials without asking yourself whether the results come from spontaneous recovery or not. 100% sensory motor recovery. We don't want to go for the quick fix. Sometimes they can help, but in the end, what we will need is a recovery where people can feel their body, they can feel human again. So this is our focus. In terms of activity, well, we are still a pretty young foundation. We are 6 years old. Until now, we have funded a number of projects which are based on the goals that we named before. The first project that we participated in was chondroitinase, led primarily by Dr. Liz Bradbury in the UK and Dr. Verhagen in the Netherlands. The target is to find a proper and effective delivery method with gene therapies to deliver the chondroitinase enzyme and neutralize the scar that comes when you are at chronic stage of the spinal cord injury. It's extremely important. It's not the only issue that you get when you are at chronic stage. Of course, you still need to get regrowth of the axons. But if we don't find a way to neutralize the scar, it seems that even though we find a solution for the regrowth, then we will still have no recovery. So that's why we invest quite a bit in this neutralization of the scar. That was also the goal of the second project that we invested in, which is the CRP peptide. This project is also still ongoing with a second research, which we have co-funded. It's been delayed, unfortunately, by COVID, but we'll have the result by June next year. The first small study had shown some promising results in terms of recovery. There was more research needed, of course, and among other, we needed to check whether a different dosage would improve the recovery level. That's a project which is led by Dr. Lee at the Cleveland Clinic in the USA. A third project is the KN gene therapy, which is led by Dr. Blackmore in Marquette, about obtaining some axonal regrowth. If you wish to receive any further information about what we do, about how we spend money, please have a look on our website. We are very transparent. Our year reports are online and the information about the projects as well. Our partners, both for knowledge and funding, some key partners are Spinal Research in the UK, U2FP, thank you so much, and the NIOS Foundation in the UK, aka Fugue Service. Thanks a lot. Now, as a third part, let's have a look at a more horizontal approach. Until now, what we described was very much vertical, meaning taking one therapy or one promising discovery from the lab and driving it all through to the clinics, driving it as far and as quick as possible. So that's the translational path for one lab discovery. That's extremely important. It has to be done. But if you look at the total picture, what you will see is that it will probably lead to some slight improvements. But if one therapy is expected to tackle one root cause, then we will need more to actually tackle various root causes. And that's what all scientists say. It will have to be a combination. So we will need that horizontal approach. We will need to combine therapies. For that, you need to have a look at the big picture. You need to map those existing promising therapies, being able to tackle those root causes. You also have to map which gaps are still existing, even after you have inventorized everything that you know right now. That being said, it looks like we will need much more disruptions at a higher level. So on top of translating what we already have, we need a disruptive ecosystem to generate groundbreaking ideas and strategies. They will need to feed the pipeline so that you get new promising discoveries to actually translate. And maybe that it's also time to think of new paths, new processes, and disrupt the whole path to the clinics. So it's not just ideas in terms of recovery, but it's also groundbreaking strategies in terms of processes, in terms of getting people to work together, labs to work together, labs working with the industry, labs working with non-profit institutions, organizations, with the government, with the regulatory. We have to work differently. We can all agree that there is progress. Researchers work a lot, they know a lot. If we look at those with very high injuries, especially those who are very young and have a whole life in front of themselves, we have to embrace modernity. So coming back to the earlier question about what can we all do, looking at the macro level, their funding agencies, the regulatory agencies could act towards developing those new ecosystems, and those goals would be established. Preferably, the priority should be given to chronic spinal cord injury because, again, that's where the market is, and if we want to have a chance to commercialize innovative therapies, we will need investors, and investors are much more likely to invest in millions of cases rather than thousands. Moreover, I would say that a change of paradigm might also be possible within the labs. We all know that there are a lot of constraints there. However, I think it's always good to ask yourself in how far the research which is carried out is in line with the goals of the community, how they can be further aligned, and what would be the shortest path to deliver results. Last but not least, the spinal cord injury community. We can do a lot. We have to do much better. We have to be much more active and driven. We can, for example, not just give some money here and there, but organize and drive things. The combination of the business approach and the non-profit values, together with the scientific knowledge from the labs, can help us to get much better results. But we have to involve ourselves. At the endParalysis Foundation, we are going to do just that. We are going to select a therapy at very early stage at the lab, a promising therapy, and we are going to do everything needed to de-risk it. We are not going to do that alone. We have a well-funded and a smart partner. That's what we need. Well, we will inform you about that a bit later, but that's what I mean by being focused and goal-driven. And I think that we can and we should be ambitious. It's not just about moving a leg, moving a toe. It's about feeling. It's about moving. It's about playing. It's about dancing. Let's do that, people. I would like to thank you for being with us, supporting us, following us. Thank you.
Dr. Kim Anderson-Erisman is the current president of the North American Spinal Cord Injury Consortium, and she will talk about their founding almost 3 years ago, and their intention to bring about unified achievements in research, care, cure, and public policy by using collaborative partnerships with all the stakeholders. She'll talk about what they're working on, what they've accomplished, and how even you can become involved. So please welcome Dr. Kim Anderson.
Hi. I'm Kim Anderson-Erisman, and I'm the current president of the North American Spinal Cord Injury Consortium. And today I'm going to talk to you about connecting with the spinal cord injury community. I'll start out with just a brief overview of NASCIC, and then I'll go into what is NASCIC's role with respect to the broader strategy for restorative treatments. And then I'll end with how does NASCIC define success related to restorative treatments. So, like I mentioned, NASCIC is the North American Spinal Cord Injury Consortium. And when we think about North America, we think about geographic North America, which is not restricted to the United States and Canada, but also includes Caribbean islands and Central America. The mission of NASCIC is to bring about unified achievements in research, care, cure, and policy by supporting collaborative efforts across the spinal cord injury community. And to do this task, NASCIC identifies gaps, communicates resources, and is a conduit for collaboration between the diverse community living with spinal cord injury and the many other stakeholders interested in spinal cord injury. I'd like to give you just a little recap of how NASCIC was formed, and it really was a grassroots effort. It started out in 2016 at a research meeting in Vancouver, and the sentiment that came out of that was that the community living with spinal cord injury needed to have a louder voice in the research process. And several individuals with spinal cord injury and with different spinal cord injury consumer organizations decided that we were going to create this voice and enable it to be a collective voice. So by volunteer, we all got together and decided in late 2016 that we would create this consortium that we were thinking about. So throughout the majority of 2017, the working group of volunteers identified what other consortiums had done, how we would model and create NASCIC, how it would operate, and we ended up with a face-to-face meeting in October of 2017, and this was in conjunction with the Working to Walk meeting that year. And those individuals that were at that inaugural meeting decided to officially form this consortium. And the official launch was in January of 2018, and we have developed membership and grown community membership. We've created communication strategies, refined our operations. We operate by creating projects. So we've created a project review committee. And you can see in 2019 and 2020, we've advocated at the SCI 2020 conference. We've conducted a needs assessment of our community. We've grown to 13 active projects, and we are beginning a capacity building program. So membership is defined into 3 different categories. Principal membership category is any consumer-led nonprofit organization that's operating in geographic North America. It can be large or small. The only requirement is that it's nonprofit and that is led by the community. Now, as of September 1, there are currently 45 principal members of NASCIC, and those 45 members have a very broad reach across the community. We also have a category of membership called patron member, and this is for an individual with spinal cord injury or a family member or caregiver directly representing someone with spinal cord injury. And they are representing themselves. They're not representing an organization. And so as of September 1st, there are 217 patron members. And then we have a partner member category, which is for any other organization or individual that doesn't meet the first 2 categories, but are actively involved and engaged in the spinal cord injury realm. And so we also have 35 partner members. So you can see here, this graph shows how membership has grown cumulatively over the 2.5 years that NASCIC has been in existence. And you can see with the map, the different geographical representations that we have so far. Our website is a great resource for information. You can review our charter, you can review our membership categories and the current members, and you can fill out your membership form, and membership is free. There's a page related to our projects. What do we define as projects? What are the guidelines, the descriptions of our current projects, and also a project review committee. We have had, inclusive of the inaugural meeting in 2017, we've had 3 other meetings, and the information from those past meetings is on our website as well. In 2018 and 2019, we had face-to-face meetings that were also in conjunction with the Working to Walk. And in 2020, we decided that we wanted to switch to quarterly online meetings, and that was further enabled by the pandemic that we're living in. But we wanted to switch over to quarterly online meetings because we wanted to enable more of our membership to be able to participate in the meetings. So you can find recordings and agendas and information from all of those meetings on our website. And then we also have been developing a shared resources portion of our website that has things like information about SCItrials.org, which I'll mention in a minute. It's got information for the community to learn about the research process, and it's got information for researchers to learn how to engage consumers. And then we also have a webinar, 10-part webinar series that was created in response to COVID-19. And that is also hosted on our website. I'll talk about a couple other of these things. So here we have a list of all of our projects, and these have what's been approved in the last 2.5 years. Throughout all of these projects, we have been able to embed 48 individuals with spinal cord injury or their family members somewhere within the translational process. And that's a great beginning. And we still have a lot more work to do with that. SCItrials.org is a collaborative project that we have created. There was a great need for people with spinal cord injuries to have a better accessible website for clinical trials. So information about clinical trials on spinal cord injuries is imported from clinicaltrials.gov, and it gets vetted and it gets put into easy to read language. And so you don't have to search through all of the non-spinal cord injury trials on this website. It also has really wonderful searching and filtering features. And so I encourage everyone to look at this website and test it out. Where does NASCIC sit in the broader strategy of restorative treatments? I think there's 3 areas. 1, NASCIC has a role to understand what the community wants. 2, NASCIC has a role to engage people with spinal cord injuries and to help place them throughout the research process. And we also feel like it's important to facilitate the exchange of information between organizations and stakeholders, because the translational process is too broad for one organization to do it by itself. So I'll give you a little example of each of these aspects. Understanding the community. What can NASCIC do to help understand the needs of the community? Like I mentioned a little bit earlier, last year we conducted a needs assessment survey of the community. We did this to guide us on where NASCIC should focus its energy. We also did this to better understand what the community is facing on a daily basis. So one of our questions was specifically, what is the greatest challenge that you face on a daily basis? And these are the themes that came out of that question. The number 1 problem that the community told us that they were facing is pain and managing pain. And then also bowel and bladder care and independence were very important challenges. Also, accessibility within the environment, dependent care and associated financial issues, and insurance issues, and then a host of other problems. So this is important for targets for restorative treatments. Our community is still facing these problems on a daily basis. Therefore, we need to do something collectively to make that change. And you can see the full report here on our website, which also has many other different questions that we asked the community. With regard to engaging people with spinal cord injury and their families throughout the research process, one of the questions that we asked in our needs assessment was, where do you want to be involved in the process of research? We gave them many different options. The number one priority that people said was that they wanted to be advisors to research teams. Okay, how do we go about doing that? Well, number one, we need to create capacity within our community, because if we want to promote researchers and clinicians to engage people with spinal cord injuries within their teams and within their projects, we need to be able to provide them with a source of people with spinal cord injuries that are ready and able to do that. It can't just fall on one or two people. So this year we have created a community engagement working group. It has multiple people with spinal cord injuries and their family members. It also has multiple scientists from different disciplines, and it's got representation from a few different funding organizations. And their goal is to create a program of content that will enable us to better prepare individuals with spinal cord injuries to be placed into the research process. So the two key variables are for individuals with spinal cord injury to understand the research process a little bit better. We're not trying to make them scientists because their expertise is living with spinal cord injury. But we do also want them to be able to speak about the community as a whole and use their experience as an individual for examples. Because we know there's a lot of diversity in spinal cord injury. And then we are, through our projects, we have started this matching assistance ability, and we will continue to evolve and enhance this as we develop this curriculum to create a broader pool of people that are able to be engaged in the research process. And lastly, how can NASCIC facilitate the exchange between organizations? Well, a really good example of how we just did that was with this SCI Moving Forward webinar series. We identified 10 different topics that might be relevant and important to our community during this pandemic. And we went out and we searched for multiple resources from multiple organizations to create this content. And here you can see a list of all of the different individuals that were actually involved in that webinar series. There's consumers, there's clinicians, there's advocacy experts, and from the United States, from Canada, all over the place. So we were really successful in facilitating that collaboration. I'd like to just end here on how does NASCIC define success about restorative treatments. We define success when our community feels the impact of research. And what do I mean by feel the impact of research? Well, research has actually a translational spectrum. In spinal cord injury, there's quite a bit of research in the basic science realm. Over the last 30 years, we really have gained a much greater understanding about what's actually happening in spinal cord injury and the targets that we can focus on. We also know we've got quite a few clinical trials ongoing, and there will be more and more phase 3 clinical trials, but that's not the end. We need to get those research, that research knowledge and interventions actually translated into clinical practice and translated into the community. Because when you reach that stage, that's when these problems that our community is saying that they're facing, that's when they start to disappear. And that's when they start to feel the impact of research. I'd like to just close here with an important acknowledgement of all of the different organizations that have provided support to NASCIC of some degree since our inception. It's been incredibly helpful, and we've been able to do quite a bit with a small amount of money. And I will just end here with information on how you can connect with NASCIC. Like I mentioned, There's a free membership form on our website. You can send us emails and we can answer questions. And we have also been developing a strong presence on Facebook and Twitter, so you can connect with us in those different realms as well. And thank you.
Welcome back, everybody. Hopefully you can see us, see me, see us. For those of you who don't know, if you've had any trouble, if you're only able to hear, open up your Firefox or Safari or find another browser. I'd like to introduce you to another one of our board members, Barry Munro, Chief Development Officer for the Canadian Spinal Research Organization, who's going to take it from here.
Thanks, Matt. Excellent conference so far. Kudos to the team. It's going great. And I have the great opportunity of introducing two really great people. Perry Cross couldn't join us today, as far as we know, because of the time difference, and that's got to be quite difficult for him. So we're going to hear from Kim Anderson from the North American SCI Consortium, and again, Corinne Jeanmaire from endParalysis organization. Thank you. Great presentations, both of you. This is actually my favorite part of the conference because we are talking about the community, from the community, hearing from the community, and actually starting to talk about solutions and how the community can go forward. And so your presentations were very great to hear, and look forward to hearing more from you in our discussion. One of the things that I heard a lot about in the three presentations is the issue of leverage and how we can possibly use advocacy and activism to somehow increase and expedite the research and funds for good quality research and identifying that research. I'm just curious, I just want to go back to you, maybe it's specifically, if you want to share with us again, how you think your organizations help in terms of creating that leverage and what your strategy is on that. Kim, you start. How's that?
All right, I'll start first. Well, there's a lot of things that our community needs to help leverage in this whole process to be able to get treatments all the way to the people that need them. One of them, what NASCIC is doing, is trying to help build the capacity so that more people with spinal cord injuries can actually be involved in different steps of the research process, because it can't just fall all on one person. And it's also important to understand that each of our different organizations does different things. And that's important because there's a lot of different problems with spinal cord injury. But for leveraging advocacy, for example, Perry Cross mentioned enabling more people to participate in rehabilitation after their discharge from inpatient. This is a major problem in the United States as well. It's not paid for. The community organizations that advocate at our Congress level, for example, United Spinal Association, NASCIC can help spread their advocacy efforts to be stronger in their lobbying of Congress to help pay for different things. So it's really important to recognize our different strengths and to leverage them to be a stronger and a louder, more impactful voice.
Corinne.
Yeah, well, for me, leverage is essential as well. We are a very small organization, so we simply couldn't exist without others. So from the very beginning, having little possibilities, even little knowledge on board, it was essential to work with other foundations in terms of using their scientific knowledge, for example, we used the SAB from U2FP. We work with ISRT, Spinal Research. They have a big network. So, yeah, this is just a perfect way. And that way you just take all the best out of this world, and leveraging and sharing knowledge nowadays is just so simple. And I believe it is not done enough. It's not done enough at community level between the foundations, and it's not done enough at research or, let's say, multifunctional scientific level.
You know, you both, I've heard this from both of you and from Perry in his conversation, that he talks about the voice and how important it is for us as a community to have a voice involved in research. Now, just to go back, Kim, my understanding is that the community engagement project that's meant to build capacity is going to be meant for everybody, for all organizations, industry as well, and to have everybody involved, and that's sort of a coming soon thing. Is that correct?
Yes, that's correct. We are building a curriculum this year that will be easy to digest, easy to understand and complete different components related to the research process. And there is a growing desire by not only funding organizations, but also by industry to engage people with spinal cord injuries into their teams. And in order to do that, you have to have a large number of people that are able to do that. And so that's what we're doing in creating this content that will be free and available across the world for people to use.
That's great. And, you know, talking about worldwide resources, Corinne, you had mentioned your various relationships, and one is with the Niall Assad Foundation and the Fuel Service. And my understanding is Fuel Service is a big funder of and how your organization works, and it's potentially coming soon to the US as well. Is that right?
Yeah. And yeah, it's just a fantastic project. It's a fantastic initiative, I would say, for the best of the community, because it's so Fuel Service is actually an app that enables people with a handicap, with a physical limitation, to actually refuel their car very easily by using modern technology. So just asking by pushing on a button on the app, not on the fuel station. And yeah, the Niall Foundation. So Niall also has a spinal cord injury. He lives in the UK, and he created that app. He designed it, he developed and commercialized it, and all profits goes to spinal cord injury research. So my foundation, endParalysis, helped commercializing that app as well in some countries down here. And that's how we use some of that profit to fund research project. I would call that really a win-win, because you know, it really serves quality of life for disabled people, not limited to spinal cord injury people, by the way. And then the profits are going to spinal cord injury research. So that's really the perfect initiative, I would say.
I didn't raise it. Actually, well, I did raise it, not to make it so much which is an important plug for Fuel Service, but I think that's an example of an international fundraiser that's all going towards restorative research, and I think that's important, and how different organizations are connecting. Because I just want to go back now and maybe drill down a little bit on both of you represent people with lived experience working to influence the research effort, and there are exciting opportunities lying on the table to partner and how we can amplify the effect of investment. So again, this is back to how do we leverage funds? And I'm just wondering, do you see other opportunities where we could be better at what we are doing, and how your organizations can possibly bring that together?
Corinne, you want to take that first?
Well, do you mean in terms of fundraising or in terms of investing those funds?
I'm going to say in terms of leveraging resources, and resources could be not just funding, but it can include, like you said, maybe just you can elaborate a little bit better on your example with working with SIRT and other organizations and working with their expertise. And I'd love to hear more about the SAB, what U2FP offers, because that's a big component to make sure that we're doing research effectively.
Well, I believe it's a question of being agile. So taking the resources where they are, and rather than building an empire, which would have been the tendency some decades ago, really joining resources and really searching for the resources that you need based on a goal. Again, that comes back to determining your goal and then doing what's needed to reach that goal. So you really pull rather than push. That comes back to what I was saying in the presentation, and that has to be a global effort because spinal cord injury is global. So for me, whether the research is, well, it may be in any part of the world, I don't mind as long as it contributes.
Excellent. Kim?
Yeah, there's a ton of resources out there already. In fact, I was just listening in on a conference last week, and a disturbing fact that about 80% of research is left on the shelf. Nobody ever does anything else with it, and that's not something that should be happening. So we should be leveraging all of our collective abilities to share information and knowledge about anything related to spinal cord injury, because it's all impactful. Something that is really important for restorative treatments is how are we going to get them out to the community? It's not enough to just have it approved by the FDA. So NASCC tries to partner with clinicians to help strengthen those relationships, so that when there are treatments out there, it's not going to be like magic that it gets taken up and is available by everybody. You have to build those relationships now as well. So we should be doing a lot of things in parallel related to the big picture.
And it's interesting talking about clinical trials, and I've seen a statistic that of the trials that fail, that over half of them, the cause of that is due to recruitment problems that we just can't. And I think the researchers that are listening today can confirm that we're having a hard time basically getting people to be in these clinical trials and recruiting them. And I think that goes back to, and you can correct me if I'm wrong, sometimes it's the original design of the program that there might not have had the people with lived experience so directly involved in design, which then leads to potentially an inactive or ineffective recruitment plan that would go towards a trial actually failing in the end. Now, my understanding too, going back to the sort of international field, there's also another database out there and an opportunity to find out about trials, and that's called SCItrials.org. Kim, you mentioned that in being NASCC being a partner to that. I think Corinne, you're well aware of that too. Is that correct?
Yeah, absolutely.
How does SCItrials.org work, Kim?
Yeah, well, actually, all of us were involved in creating it, and Corinne was involved, and actually Niall was involved as well. And a couple of years ago, actually, I think at the Working a Walk meeting, there was a big discussion about how difficult it is to sift through clinicaltrials.gov to find spinal cord injury trials, and then also understand what it is that they're actually talking about and who they're looking for. So SCItrials.org was created by the community, and it sifts through all of those other trials. So you've got just spinal cord injury trials, and it's got a very easy to understand overview of each study. And it's also got the ability, you can search on whatever, like if you're interested in walking, you can look at that. If you're interested in bladder function, you can look at that. If you're interested in neurostimulation, you can look at that. If you're interested in stem cells, you can look at that. And you can find trials that are unique to injury and unique to your location. So that's a great resource that's been built and shared across the community. The other issue with clinical trial participation is that, as you mentioned, it's not only just that some of the criteria are hard to meet, but also pre-COVID, there is a lot of things, the very little use of technology and use of virtual technology to enable people to participate. And because of COVID, there has been a great increase in scientists' interest to try to figure out how can we make clinical trial participation easier with regard to telehealth communication, doing assessments virtually using technology to buy different outcomes and things like that. So, there are a lot of things that are changing out there.
They are, and they're moving fast. I just have to remind our audience that please, if you have any questions for our panel, as we still have some time left, please submit your questions through the chat, and we'll try to get to them all. And I just wanted to comment, and as you know, conferences like Working to Walk are a huge part of the general topics that we're talking about, specifically in this section of bringing the community together and talking about collaboration. And I think we need to recognize that there's a lot of work that we as a community have to do. And I think what I've been hearing lately is that we're taking ownership for it, which is great. There's not the complaining or whining about why we're on the outside looking in. It's really about solutions and doing that. And I'm, I have to say both your organizations, of which I'm a one of, I have to declare that with North American SCI Consortium, that the focus has been excellent on how to work together and collaborate, not just with getting more people involved, but more importantly, working with the industry and working with the funders as a whole to see if we can kind of move this thing forward. My question back to you again, it might be just kind of going over old ground, but how do we get our community more involved? I know there's some issues you've already spoke of, but in general, how do we get our community more active in the ecosystem that you talk about, Corinne?
Well, I don't think the ecosystem, the new ecosystem that I mentioned in my presentation exists yet. But community involvement, well, for me, it's also a challenge to get people involved, a very big one. But I always go for being very focused. And so there are some initiatives in the background working on building the environment, like what Kim is doing. There you really have to involve the whole of the community. And but if you take some very dedicated research project, for example, it's not like you have to work with the whole world. I guess if you find a certain number of very, very motivated people and very knowledgeable people, then you can just start. So the matter is about finding the right goal and really focusing on it, I guess.
Kim?
Yeah, I think that we have to remember, what is our community living with on a daily basis? We all make it look easy to live with spinal cord injury, but we know it's not, And so if we understand what our community is living with and what their challenges are, then we can come up with small solutions that they can actually take part in. So, if it is someone in Iowa that can go and connect with a researcher there on their local level, okay, I can handle that 1 or 2 times, maybe a month, something there. And you have to take small pieces that people can fit into their difficult day. And then collectively that grows. And it's not a large commitment on any one single person. It's small commitments on a lot of people.
That's excellent. And, I have to take my hat off. Well, I'll show my bias with the UTFP and the work that Matt has done on the state level in terms of creating state advocacy, galvanizing the community and working towards an actual result of funding for SCI research. And then I look at both your organizations and what you're doing as more internationally and trying to work with other partners on a macro and micro scale and bringing together the community. But I think these are exciting times. And we have to be a little cynical, I guess, not too naive, but at the same time, looking at the work we heard about yesterday with talking about a roadmap on research, what that could mean in terms of collaboration, at least in discussion, talking about common funding things that are being put together on an international basis, international organizations trying to be people together, trying to train our individuals to be better advocates. And of course, the great work at UTFP with this conference in itself, as well as the work they're doing at the state level. So these are all great things. And I mean, we've been kind of around a little bit. Am I right to say this is probably the most optimistic our community as a whole has ever operated in that I've seen? It just seems a little different. Kim, maybe you can jump in there on that. But it seems like there's a spirit of cooperation like there's never been before. I'm not saying it's where it has to be yet, but it seems better than the past.
Well, yeah, I've been around for almost 32 years now, and seeing the different stages of our community. You know, I think what is happening is there's a growing level of frustration that is galvanizing our working together, because it's getting harder and harder and harder to live with spinal cord injury. So I think people are really starting to realize we do have to work together.
If you had a crystal ball right now, Corinne and Kim, where would you want to see your organizations at in 5 years from now? What accomplishments would you like to have under your belt by then?
Kim.
Want me to go first? Well, first of all, I'll say I hate it anytime anybody says 5 years from now, because that's setting yourself up for failure. But I would like to see our organization be able to engage with more and more organizations around the countries and collaborating across the world. Like Corinne said, spinal cord injury is a global problem. What we do in one country can impact other countries, and we have to be communicating like that. So I want to see my organization grow in its communication and its sharing and its facilitating the community.
Yeah, and as far as I'm concerned, well, I hate the 5 years timeline as well. So very bad question. But what counts for me is progress, and I really want endParalysis to be part of one very focused project, and to have done everything possible to actually bring one discovery further along the path of to the clinics. Whether we will manage is a question mark. It is absolutely not certain. There is a lot of risk down there, but at least we will do everything which is possible, and we just want to stop with the passive attitude of just waiting for somebody to keep up, to pick up promising discoveries from the lab and bringing them further. I think that we need to be much more active than that. So that's what we will do together with some other partners. Excellent.
Matt, is there any questions from the community?
Yes, there's a number of questions.
All right, I'll shut up.
Thanks, guys. Well, we'll just try to run through them quick. One of the questions is, are either of you in any part of your strategy talking with healthcare payers, insurance payers, Medicare, insurance companies as a part of your longer term strategy to, in many ways, Kim, I think you addressed this as a point that we need to be paving the road now for the eventuality. Are either of you thinking about that, talking about that, planning for that?
Yeah, payers need to be part of the roadmap. And part of what NASCIC can do with that is to try to leverage some of the great advocacy that other of our organizations have done with respect to payers, and sharing that advocacy success with other organizations in different countries. I'm for sure thinking about it in relation to my everyday work in the research that I do, and understanding what evidence payers want for proof to decide to cover something. And it's not the same evidence that the FDA wants.
Yeah, and as far as I'm concerned, well, I would say that we think about it from the very beginning. So whenever picking up a project, we really have to ask ourselves, well, does it have a chance to be picked up by investors to go to clinical trials? And then does it have a chance to be reimbursed by the insurance and to be actually applicable to humans. So yeah, it's a question. I don't have any contact, but when you choose a project and you want to fund it, you have to consider the future and the chance that it gets reimbursed. Otherwise, yeah, there is absolutely no chance.
Thanks. Maybe even on a similar note, there's a comment here, probably in some way responding to, Barry, you brought up the failure of clinical trials in SCI, large number, and somebody wrote, well, we need logistical support for people who want to participate in trials. I also wanted to ask you a question about that. So in addition to a question about that logistical support and what there exists, but also I've always wondered, with that failure rate of trials, I suspect that some of the things that were mentioned are true about trial design and involvement of people from the community. But I also suspect the targets may not be what the community is interested in. And if the targets were the target of those trials, there's those treatments or results of those trials would be of interest to the community, there might be more response from the community. Just wanted your comments on both of those things.
Well, I think there is certainly a misalignment in targets, so that's very possible. I don't have a list of which trials have failed because of problems of recruitment. But yeah, I'm going to repeat that if you organize a trial for acute spinal cord injury, for example, it will be very much more difficult to recruit people because people will be between death and life, or life and death, and it's going to be very difficult for them to sign or for them their family to decide whether they will allow you to make a trial on their family member. So that's one of the criteria. It's one of the example of misalignment of targets. There are others. We see a lot of trials and a lot of studies which are, well, according to me, not very useful, and I think according to more people.
Kim, any comments there?
Yeah, I echo what Corinne said. A large number of trials have been up to date in that acute neuroprotective time period, which is a much smaller pool of people to choose from. So therefore, you're automatically narrowing yourself down. And in those types of trials, you have to be very strict for safety concerns, et cetera. So you're almost setting yourself up for failure. But also, it's important to know that you can't just focus on one outcome. There's a lot of outcomes that are important to people with spinal cord injuries.
Yeah. Another question, what are your plans for connecting consumer organizations, or, my bias, community, SCI community organizations globally? Any?
I can tell you NASCIC has just recently, in last month, we had a national community connection talk, basically, just getting several different representatives across the globe that are involved in different aspects of SCI organizations, talking with each other on Zoom for an hour, just to introduce ourselves to each other. And we plan to do that probably about at once every 3-4 months. And there may be different organizations on it at each time. So just so that we can actually learn about each other and how we can work with each other.
Yeah, and as far as I'm concerned, well, we are an organization based and registered in the Netherlands, but we have a global profile, and as long as people can understand me and my accent, then I'm very open. I communicate to a lot of people worldwide. No problem about that, no limitation.
And you do, I can understand you just fine, Corinne.
Thank you so much.
A couple things. One, remember there's a chat board, and so those questions are there for you to view once you come back on the live stream. and feel free to go ahead and reply to any of those folks. And one of them, a little shout out to Murray Blackmore from Marquette, who, as per usual, said he would love to see folks embedded in his lab from the SCI community. You know, again, I will reach out to all of you to say, and I replied to Murray that I think both U2FP and NASCIC can help to facilitate that from amongst our Cure Advocacy Network, NASCIC's delegate members, but also to anybody in the audience. We have embedded lots of folks in labs and in research projects and on advisory boards with our state bills. So if that's something that interests you, please reach out to us. Keep talking about those opportunities, because I think we can help together to facilitate that work for those who are willing. And that it goes for research scientists as well, or clinicians as well as community members. That's all the time we have for the panel. So feel free, again, if you want to keep asking questions of these folks, do so on the chat board. And Corinne, Barry, Kim, you can reply to them there. Thanks so much. And then also remember, you are most welcome to join the Zoom meetings at the end of the conference day to continue this conversation. So thanks so much for your presentations. Thanks, Barry, for moderating. Appreciate it.
Thank you.
All right.
Bye.
Bye. So now we are going to jump to our friend Kelsey. Hello, Kelsey. And our other friend Jesse. Hello, Jesse. Great to have you guys. This is a continuation. Just wanted to remind you of our artist interviews. Again, to remind us who we are, that we are connected, that we share stories. And now we're going to watch a little preview of Jesse's work, Jesse Sinz, and then he's got with you. Thanks.
Nobody's able to manipulate what you're trying to put out there, whether it's how you feel or just for shits and giggles. It's your freedom, something nobody can take away from you, which is very rare these days. That's why I like, or I should say love what I do. I'm Jesse Sinz, graffiti writer out of St. Louis, Missouri. What do I do? I paint graffiti, practice different kind of fonts and lettering, typography, and exploring characters and whatnot, playing with color. That's what I do. Something I've always been passionate about, so I strive to do it still to this day. Or it drives me, so I keep continuing the endeavors of graffiti. And you can never stop creating. It's always changing and evolving. What's it like? Freedom, I consider it being able to express yourself. Because I love it, something I've always been passionate about, so I strive to do it still to this day. No, I don't really do it too much, and if I do, I don't speak on it unless I do stuff, with quantum, which is, again, for the abilities expos again, to show kids and everybody else that, you know, whatever happened or is, can't necessarily stop you from what you like doing. You just have to find other means of doing what you love to do or are very passionate about. And that's the end game on art displays and shows. Regardless of any situation, at the end of the day, if you put the effort and work into it, you can still live a normal life and you can be content and still do what you're passionate about if you really put your heart and your efforts into it. And, you know, you're gonna have trials and tribulations, but if you persevere and keep pushing, eventually you will get good results. But your heart has to be in the right place, and you have to really be passionate and keep your head up, because that's the hardest part. Trials and tribulations. And also going to new cities always accomplishes a lot, you know, just to meet and talk to other people that you see via, you know, social media and all that, because nobody interacts in person-to-person contact anymore. So that's always special. I get a lot of praise for doing what I do and being very adamant about it, I guess. So I guess I inspire other people to do whatever they do, I guess. So when people ask, but on occasion I will, just for the common factor, or just to put it out there to let it be known, you know, and, you know, to give a hand up, you know, for other people that don't really see what's going on with people with other disabilities or whatever it should be, that don't really get much reception just because of the hype and where art comes from and thrives from. People don't really give respect and ups to people in other conditions, so I kind of want to make that aware a lot of times when I do these things in the long run. Sometimes people are like, this is the best thing I've ever seen. Not the painting part, but the actual doing it with a mouth rather than hand or foot, you know. Sometimes you get shock value out of it. Some people kind of are thrown off about it. You know, it's kind of like this is really happening. So I think that's really cool, and it's cool to see kids' reactions, you know, to see, you know, art being conveyed in a different form. So I think that's probably the key is, you know, keeping the little ones motivated to do whatever they love, you know. I'm Jesse Sinz, graffiti writer out of St. Louis, Missouri.
Hey everybody, what's going on? Kelsey here with Jesse Sinz, the mouth painter, the man.
Hey, what's going on, everybody?
Where you at?
I'm in St. Louis, Missouri, where it's getting really cold real quick.
Yes, that's happening. That's happening everywhere. I haven't seen you in a while, dude. I think the last time I actually saw you in real life was when I met you at the Abilities Expo in LA, and I interviewed you for film. And you actually told me about how you were a graffiti artist pre-injury.
Correct.
And injured while you were tagging.
Yeah.
Right?
Correct. I live and died by the sword, if you will. Long story short, I was with some friends and we were on our building doing our stuff, and things happened and I fell off the roof and broke my neck, and came back from that injury and kept doing what I was doing on that wall.
Well, right. What was it like translating? Like, what was your process like before, and how did you translate that into what you do now?
Well, the hardest translation was trying to figure out how to represent my style and the way of writing into, I guess, using the mouth instead of a hand, which kind of can move and manipulate like a hand, but to learn it and to be patient with it is a totally different thing. That was a very long process, but without knowing the graffiti knowledge, I don't think I would be able to do that.
Right, because you're using like a different medium, you're using a different part of your body, you're using different paints and tools and everything, right?
A little bit of all that. Even when they tried to use my hands to write regular handwriting, I would do bubble letters first because graffiti comes before cursive or anything in my world. So they found that really weird that I could make bubble letters of everybody's name, yet I couldn't write my name in English for nothing.
How do you decide what you create? Like, where does that come from?
It kind of depends. It varies. Sometimes it's Pandora's box, whatever comes to mind. Other times it's ideas, maybe inspired from what happened that day to somebody else's conversation I had. Or maybe it's a commission piece somebody wanted to do and I kind of elaborated on it.
Mm-hmm.
I try to pull from anywhere.
Are you usually doing like words of some sort, it looks like?
I try to stay with the lettering because that's what I like, but I try to jump off the porch and do different mediums with it, just to play with colors and do abstracts and whatnot.
Yeah, I've noticed you've been drawing more too lately. Like the hands you were doing looked so cool. Talk about that. Like, what's that been like? When did you start doing that?
I just started sketching again. I guess in real life, probably a year and a half ago, because it's painting and sketching by mouth are totally different. Mm-hmm. Being that I want to say the things that you use, like the mouthpieces, the sticks, sometimes aren't stable enough. So a pen and a pencil, you have to be very straight and coordinated. Otherwise, it'll be very sloppy. So that it's a lot of patience to learn, and your sketches come out like a 12-year-old or a 6-year-old did it, at first. But as you play with it, you learn to readjust. So that's what I'm trying to do, is trying to get it back so it looks like a hand's doing it, if you will.
Mm-hmm. So you feel like you're still sort of in that process of figuring out this new...
Oh, absolutely. I'm just now getting into the shading without losing my mind. So I'm working on it. Definitely working.
Is it exhausting? Like trying to does it hurt your neck anymore? Or are you just like Superman now as far as that goes?
No, I do. I have a blowout. I'll do a 4 or 5 hour session because once I stop is where the problem is. So once I stop, the pain will start coming. And what that is, as long as I try to stretch and relax as much as possible, I kind of just let the pain subside and do its thing and it'll go away. Other days, it is what it is. It's a mess and some ibuprofen is needed. Yeah.
Like how long do you paint for at one time? Hours or?
It depends. A session, the minimum has to be 2 hours just to get into it. So I try to do at least 5 to 6 hours straight. If I want to go the whole day, I'll take a couple hours break for food and let my neck do its thing so I don't blow myself out. Otherwise, the next day I can't really move, and that's not fun.
Yeah, no kidding. No, do you like how I just threw in the Superman unintentionally? Like it's just like ingrained in.
I wish it was that easy. Yeah, it makes it look like it's easy, but no, I'll cramp up. I can't move, but it happens, you know.
Yeah. How do you feel like? Do you feel like having an SCI has influenced what you create and why you create?
Could you say that again, please?
Do you feel like having a spinal cord injury has influenced what you create and why you create?
It definitely changed the way I think about the process of thinking, and it definitely slowed me down to give me the patience to reanalyze like different situations or concepts that I want to do. Other than that, not really.
Are there any other artists like mouth painters that you know have helped you develop how you do this?
It's not really. Like I've always looked at people like the first guy I saw was Benny Dyer. He was a graph writer, and shout out to him. He had an injury and he's in the same position, and he's still out there doing it. So I kind of looked up to him during it, but before that, not really. I just kind of, my therapist told me about it, and we didn't even did any history on it. We just went face first
You've
into
just
it.
been winging it.
Yeah, pretty much. Yeah, because everything you have to fabricate most of the stuff because they don't really make that stuff, and if they do, it's so expensive. Like, I'm good. I go to Home Depot and build it for $1.25. You know.
Yeah, you're just figuring it out.
Exactly.
I like it. What are you up to right now before I think we have like 30 seconds left. Tell us what you're up to now, what we have to look forward to.
I'm working on some logos for some businesses. Since I'm doing logos now, I do tattoos, obviously graffiti. So I do a little bit of everything, commission work, advertisements, whatever. Just DM me, that's what I do. I basically try to become something with my art.
You are something, dude. You are something. You're getting it done and doing it, and so much swag.
Thank you.
Yeah, for sure. Thank you so much for joining us. It's been awesome.
Yeah, it's a swag competition between you two.
Oh no, I think Jesse might take it.
Well, thanks, y'all. Really appreciate it.
Have a great
Jesse,
one.
Instagram handle.
Jesse_Sinz, SINZ, Jesse, JESSE.
All right. Thanks so much. Appreciate you.
You guys have a great one.
Thanks,
All
Jesse.
right.